At Intelligent Health Group, knee arthritis is one of the things that we specialize in, but, it is one of the very painful conditions, certainly, a lot of people go through. I'm sure or somebody that, you care about has knee arthritis. Again, it can be very painful. It can start to lead to swelling, mobility changes. You start to need a cane, then maybe a walker. Ultimately, there's even talk, obviously, about knee replacements. And knee replacements are very common these days. Again, more and more people are starting to get problems with their knees. Ultimately, we weren't meant to be living and working on hard surfaces like we are from an evolutionary perspective. But that's what happens. We're on hard surfaces all the time. We don't have the best footwear. We don't understand, or we haven't been told about custom orthotics, or making sure that our arches are the same height, that we're reinforcing our posture from the ground up. We don't know about these things. And so what happens is there's more stress on our knees. They talk about 10,000 steps a day as a good fitness thing, but imagine 10,000 impacts into the knee joints with every step that you take. So if it's not fully supported with the right footwear, with making sure that your arches are not flat, that your arches are the right height on both sides, that your posture is good, there's more stress in your knee joints, and they start to wear away quicker. The other thing is being overweight. And, a lot of people are overweight now in this day and age. Look at the food supply we have and the habits that we get into. But it's especially important and relevant when we start talking about knee arthritis, because every pound that we have of body weight is equivalent to 4 pounds of functional weight on our knees. Our knees have to do 4 times the work to hold every pound of our body up. And so there's a great deal of stress in our knee joints. So they can start wearing away quickly. When I say knee joints wearing away, there's a cartilage in between the knees, and that starts to wear down. It's kind of like brake pads in our car, that with use, they start to wear away. So as our cartilage wears away, that's called arthritis. And with that then, you start getting a drying up of the fluid, the natural fluid inside the knee joint, called synovial fluid. And what happens then is the joint starts to swell. You get inflammation in the area, more pain, redness, and then your knee joint starts to change shape. Bone spur starts to develop. Extra bone starts to form at the edges of the joint. And you can start getting a lot of mobility issues. That's when you start to get those clicking sounds and grinding sounds in the knee as well. It's especially painful when you start going upstairs. If you go upstairs, there's more, again, stress and gravitational force on the knees. When you're coming down the stairs, it's easier. But certainly going upstairs is harder. As mentioned, again, the knee joint can start to change shape as well. There's also something called a Baker's cyst. A Baker's cyst is an extra cyst formation behind the knee joint as you start getting degeneration. It's another sign and symptom of that. That also creates limitations in your bending and can be very painful at times. So knee arthritis, what can we do about it? Obviously, once you get it, what we know is we can't reverse knee arthritis, but we can certainly slow it down. And that's what we're going to try to do. We're going to slow down the knee arthritis by making sure that we have regular treatments on the knee. Now, we've developed at Intelligent Health Group a revolutionary program of care for knee arthritis, and that incorporates a knee decompression technology, and it also incorporates a class 4 laser, horizontal therapy, and active physiotherapy. The combination of those things is amazing. So the horizontal therapy helps to improve the fluid or synovial fluid in the knee joint. It actually produces it. Next, we start talking about the class 4 laser. It improves blood supply to the area, and it reduces inflammation. The knee decompression is very new technology where we can actually put you in a machine to actually open up the knee joint and take pressure off the cartilage, allowing, again, blood flow and synovial fluid to get in there nicely and to hydrate the cartilage. Once that's done, doing the proper physiotherapy, strengthening the muscles around the knee joint, will help to stabilize the condition. In addition, of course, us as chiropractors, we make sure the joint movement is good through chiropractic adjustments. So as you can see, it's a very comprehensive program. And just doing that for a short period of time helps to stabilize the condition. and we slow down progression of the arthritis. But what you'll find symptomatically is that you'll have less pain, less inflammation, more movement. So that's the beauty of it, and that's what we can do for knee arthritis. So aging does happen, but we can slow it down, and we can certainly support what's there and relieve you of any of the limitations that you have now and the pain you have now. We'll be going over this and a lot more on our Program of Care webinar, where we go over the secret sauce to our knee programs. On September 25th, this coming Thursday, from 7 to 8, we're going to go over this in detail, what our program involves. We'll talk and answer questions about the knee problems and knee arthritis. And also, for those attending, we'll have a very special offer, a much discounted opportunity to enter our program as well. So you don't want to miss that. So looking forward to having you tune in. Do register using the link provided. We look forward to seeing you there and helping solve your knee issues.